Welcome everyone to the Ask Me Anything About Kidney Donation session. You all heard about kidney donation through the Herman Lopez excellent article in the New York Times, and I'm really grateful that so many of you have stepped forward to find out more about kidney donation. It's a really exciting opportunity to save a life. And I did it back in 2020 after my son donated his kidney to a stranger at age 19 in 2019. And it really changed my life in a very positive way. So I'm very happy to share some information with you. I'm going to start out first with questions that were sent to me. And then from there, I'll go to your questions. And hopefully this is going to be interesting for you. And thank you so much for just wanting to save a life. I think there's nothing better than that. So let me bring up the questions. The first one is there any kind of weight requirement in order to become a donor? So it turns out that there is under a BMI of 30 is considered to be ideal. A BMI of between 30 and 35, some transplant centers may accept that, though other centers may ask for weight loss before approving. And anyone with a BMI above 35 is probably considered to be not quite yet ready for organ donation. Now, there are programs like University of Chicago runs a free program to help potential kidney donors lose weight and quit smoking so that they can, in fact, get the honor of saving a life by donating a kidney. So the next question I was sent is, are there medications that disqualify you from donating? Now, there are certain medications that would disqualify someone from donating, and they would be things like immunosuppressant drugs, any antiretroviral therapies, certain acne and prostate medications perhaps, blood or cancer medications, any kind of chronic pain medication that would impact kidneys might be a reason to be disqualified, or any medications for uncontrolled diabetes or high blood pressure or cancer if it's not in remission could be disqualifying. Now, it's important to know that the saying goes, when you know about one transplant center, you know about one transplant center, and meaning you don't know anything about the neighboring transplant center. So just as an example, there's this guy named Scott Alexander. He's known as the public intellectual for the Silicon Valley crowd. He is a middle-aged psychiatrist who wanted to donate his kidney to a stranger at University of California, San Francisco. They disqualified him because when he was a teenager, he took OCD medication. Super strict. He flew over to New York City at Cornell Hospital and donated his kidney. They were fine with the fact that he had been on OCD meds as a teenager. So sometimes donors shop around, and certainly if you live in an urban area, you have that luxury of shopping around. So each center has its own qualifying standards for donors. Also good to know that if you are a person who uses a lot of NSAIDs, also known as ibuprofen or Advil, these are anti-inflammatory drugs that negatively impact the kidney. They really stress the kidney out. And so following donation, you're really not supposed to use them, though I do have kidney donor friends who use them very occasionally. They suggest that you not use them because you want to take, super good care of your remaining kidney. And other kinds of drugs, perhaps you would need to stop them for the time that you are donating, and then you can return to them. So it's really a discussion between you and your healthcare team in the transplant center. How long is the recovery time? So the whole journey is that it takes about 6 months to get evaluated for transplant on average. I would say my experience was much quicker at NYU Langone because they did all the testing in one day. At other centers, they may string it out in a longer way, but here in New York City, we get things done very quickly. And so I had a pretty short evaluation period, after that, I was in the hospital for 3 nights. Most people are in the hospital for 2 nights, though my friend Steve was in the hospital for 1 night after donation. I was able to work the day of surgery from my hospital bed. I took walks. I had guests for dinner. I was feeling really good. I had really good pain management, and I got the tip from my surgeon that I should take my next pill 5 or 10 minutes before my current pill wears off, because he said if you get into a pain state, you need more painkillers for longer. And so, but on average, people are in the hospital for 2 nights. And then by the third day, I was released from the hospital. And I live in a 5-floor walk up, meaning I have to go up 5 flights of stairs to get to my apartment. I was able to climb those stairs with no issue whatsoever, just to give you a sense of how good I felt. And I was back at work 2 weeks after the surgery. If you need to lift for your job, it will be about 6 weeks before you can lift anything that's heavy. So just keep that in mind. The next question is, are there any lasting health effects for the person donating a kidney? There are. The first one is that you will have a reduced kidney function, but that's okay because our 2 kidneys and even my 1 kidney, even though it has grown in size, still doesn't work at 100% capacity. So it turns out that, 1 in 500 Americans are born with only 1 kidney. And they don't even most of the time find out about it. So we are just fine with 1 kidney, though you will have reduced kidney function. The next one is that it's very rare, but donors do have a slightly higher risk of developing end-stage renal disease when you compare them to very healthy people. So if you compare kidney donors to the general population, the chance of chronic kidney disease is far lower. But if you compare them to other extremely healthy people, there's a slightly elevated risk of getting kidney disease. That's why they do such an intensive evaluation of us to make sure that we are in top health. And in fact, living kidney donors live longer than the general population as a consequence of that scrutiny. Sometimes there might be a slight long-term increase in blood pressure for some donors. There could be some pregnancy risk of preeclampsia in some donors. And so it's a really good thing to just have a good conversation with your transplant team. There are potential surgical effects as well because, it's a major surgery. There's no way around that. And so it's just a good thing to go into it with a lot of questions so that you're going into it with full awareness of the risks and also the benefits of kidney donation. And are there any financial obligations by the person donating? It turns out that since the Nixon administration, when somebody gets kidney failure, the taxpayer pays for their care. It's about $100,000 per patient per year to be on kidney dialysis. And so when they get a transplant, which saves the taxpayer for each transplant about $500,000, the transplant is paid for by Medicare, mostly. Unless the person's on private health insurance, which most people on dialysis are not, your surgery would be paid for by the taxpayer. Now, you may have travel costs, you may have lost wages, you may have child care, elder care, and there are various programs that can help you with those. One is the National Living Donor Assistance Center, which is a federal program for reimbursing all costs and lost wages. They actually give you a credit card to put all your expenses on. There's also the National Kidney Registry's Donor Shield, and there are various programs around the country. There are tax credits and deductions as well in 22 states. So there are multiple ways to help you be cost neutral after donation. And so that ends the number of questions I was sent. And so now I'd like to go to my enormous audience and ask, do you have any questions you'd like to ask about kidney donation, my absolute favorite subject?
Well, I'm 73 years old. Is that age a factor in this?
Interestingly, yeah, great question. Interestingly enough, it's not our age, but it's our internal health. There are 20-year-olds who are not healthy enough, and there are 73-year-olds who are healthy enough. My friend Tom donated his kidney to a stranger. He's from Texas, and he was 74 at the time. So there are people in their 80s who have donated kidneys. And so it really is a decision that the doctors are going to make. They will check every cell in your body to make sure that you're healthy enough. They don't want to take risks. It's an elective surgery. It is throughout the entire process, from start to finish. Every time they talk to me, they would say, you don't have to do this thing. You don't, you can back out at any time. It's no problem. We totally understand. Even in the operating room, they told me I didn't have to do this thing, right? And so they're so cautious. They want to make sure there's full consent. And so once they inspect you, it'll be the best inspection of your life. And sometimes people find out stuff during that inspection that they wouldn't have found out otherwise. And so it's life-saving for the potential donor as well. But they will check every cell to make sure you're in top health. Now, those tests include tons of blood work, an X-ray, a CAT scan. Now, you can ask for an MRI. That way you won't have the radiation exposure. They're going to do a stress test, so wear comfy shoes. I wore clogs, which I had to do it in bare feet. That wasn't such a great thing. And they do lots of psychosocial evaluation. Now, if you're donating to a loved one, they will do a psychosocial evaluation. If you're donating to a stranger, they sort of do a triple level one to make sure that you really are of sound mind and body. But they will decide for you. And so absolutely 73 is a great age to donate as long as your interior stuff is in top health.
Okay, thank you.
Sure.
Elaine, I was wondering of part, like where are the centers and is there any help or support in sort of understanding logistically, where to go or what the options are?
Absolutely. So I can give you a map of centers. Where are you located, Roger?
I'm in Boston.
Okay, so there are about 250 transplant centers throughout the country, and about 100 are associated with an organization called the National Kidney Registry. Now, if you go with a hospital that is with the National Kidney Registry, there are a lot of benefits for the patient. So I was NYU's first National Kidney Registry patient. And so because I signed up with them, I am now prioritized. Now, I gotta say, every donor is prioritized for a kidney. If in the unlikely chance you would ever need a kidney, you would go to the top of the list. Most kidneys are deceased donor kidneys. Living kidneys last 2 times as long. So if you go through the National Kidney Registry, you'll be prioritized for a living kidney rather than any kidney, right? That's advantage number one. Advantage number two is if you're donating a kidney to a stranger, you put a kidney into the system, you can then get a voucher for a loved one to get a kidney. And so I see it like kidney insurance, right? Very unlikely anyone in my family is going to need a kidney, but that is a question I was asked. Hey, you're giving your kidney away. What if someone in your family needs it? The National Kidney Registry will provide the voucher and help you out in that way. Also, they will they will pay all of your costs and lost wages after donation. Okay, so that's a huge benefit as well. And so it doesn't matter your income level. And so those are some really solid reasons to go through the National Kidney Registry. When I share my follow-up email, I will include the map of the National Kidney Registry transplant centers, but there are so many in the Boston area. And so we can also talk offline about certain centers that I found that my friends had good experiences in. That doesn't mean the others are not good. It just means I'll just say it right now, Brigham and Women's, is that what it's called?
Yeah.
That's
Yeah, yeah.
apparently a place where they take very good care of patients.
Yeah.
I'll just say it.
Okay, that's great.
Not to say that the
Yeah,
others aren't great, right? But just
yeah,
that's what I've heard.
yeah. And I appreciate your answer was helpful also for some of the questions that have come up from family members around, just concerns about what would happen if in any case, a donor would need a kidney or a family member. And so that's helpful. I appreciate that. That was also a question I had.
We're
Yeah,
now more protected, right, than ever
Yeah.
before because of my donation. My son, as I said, donated 6 months before I did. He was not a National Kidney Registry patient, and now I feel good that he's protected, that he can get a living kidney if he would ever need one. Now they do that full inspection to make sure that it's very unlikely, but accidents happen and things like that.
Yeah. Yeah.
Great. Megan, any questions?
No, that was actually my question, was that sort of like what happens if somebody needs it?
Yeah. And that's really something seriously to think about. Every year about 500 Americans donate kidneys to strangers. That's just a little bit more than 1 in a million Americans. And so, as you can see from what's above me, I am obsessively trying to pass the End Kidney Deaths Act, which will provide a tax credit for anyone who donates a kidney to a stranger. And in that way, we can finally end the kidney shortage. It's a tax credit of $10,000 a year for 5 years, $50,000 in total. And we have it introduced in the House. We have about 59 House sponsors. We're trying very hard to get it introduced in the Senate, and just super impatient to get this bill passed because 1 American dies every hour on the kidney wait list. That is unacceptable. It's really this is a solvable problem. So very excited to solve it.
Elaine, I'm curious about your motivation. I mean, it's so refreshing.
Yeah. So
it's very refreshing to see your commitment.
Oh, thank you, Roger. That's really touching. Listen, it is the greatest dopamine waterfall of my lifetime, right? I did it
Yeah,
5 years ago, and every time I think about it, my heart is full of joy. It is one of the
yeah,
best things a human being can do. And listen, not everybody's qualified to do it, right? But
yeah.
the fact that you three want to do this thing is just one of the most beautiful things in the world. And listen, the world has always needed a lot of healing, and this is a truly beautiful thing to do, to use your own body to save the life of another human being and also someone you don't know, right? There's no complications. There's no thank yous. You just give the
Yeah.
kidney out there into the world. And the beautiful thing is that I was able to donate my kidney and launch what's called a kidney chain. Now, not everyone knows about kidney chains. My son really wanted to do a kidney chain, but they said to him, listen, you are a perfect match for a 21-year-old who's dying down the hall. So my son
Mm.
said, say no more. I don't need to do a chain. So I said, listen, I'm your chain. And so in my case, my kidney flew from New York City down to Emory Hospital in Georgia. And in order to receive my kidney, that recipient had to have a donor who was willing to donate to them, but just wasn't a good match for them. But that person was a super match for someone in Oklahoma. So then the kidney flew from Georgia to Oklahoma, switcho changeo. Another one then went from Oklahoma to Washington State. And then the fourth kidney went to someone who didn't have anyone to donate on their behalf. And that was someone at the top of the kidney wait list, someone who's waited the longest for the kidney. And so 4 people in America are hopefully having the best days ever because I've known people who've gone from dialysis to transplant. It's like going from dying to fully living. It is fantastic. And so it's a joyful thing. And I appreciate your emotional response because it's so beautiful that there are just almost no words for it.
Thank you. I'm curious about. I have heard among organ donation, sort of the system and just organ transplants, that there is some amount of dysfunction, and I'm wondering if any of that was ever an issue about. I mean, it almost seems like that in this instance, there's a way to prioritize and make sure that someone gets the organ. You don't have to worry about wastage or about something in the system that goes awry. But I guess just curious, yeah, if there's anything about the system itself that might complicate things.
Yeah, good question. So, yes, 2025 was the year of bad stories about organ
Yeah,
donation, right? There was the story about, people not quite yet dead, and they were thinking about procuring the organs. I've heard from very reliable people that those were based on misunderstandings, and no one was ever about to be cut open that was alive, right? And
yeah,
so there's communication problems sounded like and this is from very reliable doctors. I go to a lot of these doctor transplant conferences now. Doesn't matter what the reality was, the perception was, and the articles framed it as something that really was about as terrifying as it gets, right? And so that was really bad news. Then there was the one about rich people cutting the line, coming from other countries and paying millions of dollars to cut the line and get an organ. Then there was another one about that people weren't honoring the line because the line is based on how long you've been waiting, and they let people jump the line for unknown reasons that weren't really documented, and so that was quite fishy. And so the deceased organ donation has taken a hit, and supposedly there's been a mass exodus of people from the deceased donor registry. About 30,000 people by last count have left. Now, in coincidence with that, we've had the number of deceased donors has steadily increased even during COVID, and it took quite a little bit of a dip, like a 6% dip this year. And a lot of people are shouting, hey, it's because of all this bad news about the organ donation system. It turns out it's really actually for an excellent reason, which is that opioid deaths are going down. The reason that steady climb has been going on is on the backs of young people who've been dying from opioid deaths. So I welcome that those deaths are going down. The consequence is fewer organ donations. Now, one of the really crazy things I found out by being in this world, I've been advocating for new organ donation policies for about 3.5 years now, is that the federal government totally ignores living donation. So there are about 20,000, 22,000 deceased donations, and there are 6,000 living donations, and there have been 6,000 living donations every year for 25 years. There's been no increase, and the federal government ignores living donation. And so I would love for the federal government to start paying attention to living donors, but it hasn't. It isn't the same problem, because a living kidney starts working as soon as it's attached on the operating table. So many people get deceased donor kidneys that are scarred or slow to wake up, and they need to return to dialysis for a time until the kidney wakes up and starts functioning again. And so that's one problem. Deceased donor kidneys are also it's just way more complicated with the families and so on. You can imagine a living kidney is donated willingly, begins working right away, and lasts twice as long. So there's really no room for sort of nefarious behavior. It's all very direct, and it's all very quick. And so, and it can be planned, right? So as a person who's donating a kidney, if you're donating to a stranger, you choose the date, right? It's a beautiful system. And one, as far as I know, without any scandals, which is beautiful.
That's great. Thank you.
Sure. That was a very long answer, but I'm obsessed with this topic. So.
Yeah, no, I appreciate it.
My sister
You're
had.
answering,
Oh,
I
go
feel you're
ahead.
answering all the questions along the way that that we have.
Oh, good, Megan. That's always good news. Thank you.
My sister had a kidney removed, and I guess about 1969 or 70.
Wow.
So it's good to hear that if something happened to her, that could be covered. She's been fine for many years, so I'm assuming no. But
yeah, but it's a good feeling, right? To know
Yeah.
that she would be covered. Yeah.
she didn't speak to me, but she would if I gave her kidneys.
Yeah, I mean, miracles can happen, right?
Yeah, right.
Another good
Anyway.
reason.
Yeah, the funny thing is that in order for her to be registered as one, you can select up to 5 people to be registered as the person who would get the kidney. You would need to communicate. She would need to actually share saliva to make sure it was really her. And so there would be some level of communication. It could offer some healing within your family. You never know. But I'm not promising that level of miracle. But I think that it is an amazing opportunity to have people just have peace of mind, right? So
Right.
it's really excellent.
My other question is, now I take a fair amount of medicine. For one, I had a heart attack about 15 years ago, 20 years ago almost, I guess. But my internal, every time for the last couple of years, every time I get the blood work and everything is great,
Good.
but I still take a lot of meds because I've had this or that or the other thing.
Yeah.
Uh.
And that's where the transplant team would kick into action, right?
Yeah. Right.
They're not going to put you at risk. First of all, they can be shut down, right? And then lots of people will not survive that, right?
Yeah.
And so they don't want to take any chances. And so they will examine everything, and they will determine whether you're a good candidate.
Right.
And if you're not a good candidate, listen, we're in a system right now where over 90,000 people are waiting for kidneys and half die waiting, right? So they need our voices. They need us to advocate because they are too sick to be able to advocate for themselves. So it is really grim to get kidney failure. And, as your sister has proven, you only need one to survive and thrive. But for those who have none, and they need to go to dialysis treatment for 4 hours a day, 4 hours at a time, 3 times a week, it's a rough existence.
Yeah. I just had a cousin die not too long ago. He spent a couple of years on almost every day, I think, toward the end on diet. But also, you said stress test. I also have neuropathy. I got lots of. But I can't do a treadmill because I have no feeling hardly in my legs, especially once I start doing it. I usually have a nuclear stress test.
They will work it out with you.
Yeah.
Listen,
Okay.
they are going to speak with you and understand where your health is. And listen, they're only going to do what's best for you. They're not going to put you in harm's way.
No, I understand that.
Yeah. So, yeah, but I wish I had an excuse not to do the stress test. That's pretty good.
Yeah, I didn't enjoy them when I could do.
There's no pleasure in that, no.
No, there isn't. But I walked 2 hours on the beach today, so I'm
Oh
not too
my
bad.
gosh. Well, now you've got it. You're saying you've got it really good. Listen, that sounds fabulous, and yeah, they work things out. But
Okay.
it is. It's interesting because I've been to, I think 5 different transplant doctors conferences. Transplant doctors just happen to be really cool. And so I once asked a group of them, like, I've known doctors my whole life. Why are you so much cooler than most doctors? And they said it's because we are collaborative. Most doctors are solo operators. If you want to go into this field, you have to be a person that likes to work with other people. So it's sort of self-selecting. But you'll like the transplant teams. They're really wonderful.
Thank you.
Yeah, they're a good group. Any other questions? Well, listen, this is all I talk about. So if any questions arise, please feel free to be in touch with me. I just want everyone to get transplanted. So the more donors we have, the better our world is. And if you are interested at all in the End Kidney Deaths Act, you can also reach out to me for that and join our mailing list. I have monthly meetings, and I send out like an Action Friday email to people. And yeah, I go to Washington every month to try to persuade our leaders. We've had over 1,000 meetings in the last 3 years to
Wow.
congressional meetings. Yeah, it's nuts. And so everyone seems to like the bill, but everyone's distracted with all kinds of things that I consider unimportant. And so we have to persuade them that this should be front and center. It's an opportunity to save 10,000 lives every year and $4 billion in taxes every year. Like, who can resist that, right?
Yep.
Thank you for all of your work, Elaine, and please convey my thanks to your son as well. I think one last question I had was, I think I'm unclear about whether or not you are part of some organization. I think in the article that I read in the Times, it had a link, and so I just don't know, like, is it that you just go to a transplant center, or is there a central hub or agency that you are affiliated with that does something?
Yeah, so my role is that I'm the executive director of an organization called Wait List Zero. And I say it that
Okay.
way because some people think I'm saying Wait List Zero. Wait List Zero.
Uh-huh.
And I also am the president of the Coalition to Modify the National Organ Transplant Act. That's part of my work in trying to really change transplant policy for the better. But I also am a big fan of the National Kidney Registry, and that's why I will send you that link so that you can
Okay.
sign up with them so that you can get those benefits I spoke about, like being prioritized for living kidney. So I'm not affiliated with the National Kidney Registry. There's also another group called the Alliance for Paired Donation, which does similar work to the National Kidney Registry. So there are two similar organizations, and they often are the people behind the chains. So that's an important thing to say, that when you go into the hospital, if you're donating a kidney to a stranger, please insist on launching a kidney chain. First of all, it feels great, but also it's an opportunity to let them know that you just don't want an in-house donation. You want to impact multiple people. So that's possible through the National Kidney Registry. So that's why I think it's smart to start the process by clicking that link that I'll send you, the National Kidney Registry link. And then from there, you'll select the transplant hospital in the city that you think you want to go to. And from there, they will send you a prescription for blood work, urine analysis, and yeah, you have to pee into a jug for 24 hours. That is always during a work day, so that's a bit awkward. But yeah, there's just all kinds of hoops you have to jump through, but they're all in service of making sure that you are in top health, mental and physical, and ready to donate.
Great. Thank you so much.
Yeah, thanks a lot. I look forward to hearing from you.
Great. Yeah. So I'll follow up with this recording and an email. And thank you all for coming. And thank you to those who sent their questions in. This was a lot of fun. And please know that if there are any questions that arise, anytime you want me to, even if you're in the area, to visit you in the hospital after you donate, like, I'm totally into this. So just let me know. And thanks so much. And just enjoy everything. And thanks for thinking about donating a kidney. Bye, everybody.
Thank you.
Thank you.
Thank you.
It's great. Bye.
Bye.